Good afternoon, everyone, and welcome to the 17th session in our webinar series on integrating psychological health and safety in your workplace. Before we start, I wanted to mention some housekeeping items. Please note the chat box, which can be found on the right of your screen, where you can ask questions or make comments. When asking a question, please make sure to send them to all participants, which can be found in the drop-down menu beneath the chat screen, and I will ask them on your behalf. I also want to mention that this webinar is being recorded and it will be archived on the MHCC website following the presentation in approximately 2 weeks, and a French version of the slides will be made available as well. Due to the large number of participants today, you're all on mute to eliminate any background noise. So please use the chat function for the entire presentation. So let's get started. My name is Nitika Rewari, and I'm the Program Manager in the Workplace Mental Health area at the Mental Health Commission of Canada, and I'll be your host today. I'm also the lead of a national study. It's called the Case Study Project, and we've talked about the study a little bit on our webinars. And we will be speaking to some participants on the case study project today. Joining us also today is Pam Fitzgerald, an educator, therapist, and an expert on the topic of grief and trauma. Pam is the director of the Canadian Centre for Bereavement Education and Grief Counselling, working with her associate therapists, Kamala Trudden and Deanna Slater. She is a registered nurse and a certified trauma specialist with an MA in counseling psychology. She has worked with criminal injuries and victim services and has supported her clients in their learning and healing for grief, anxiety, panic disorder, and traumatic stress, PTSD, as well as depression. We also have the Pickering Public Library here today. Many of our listeners have heard us talk about the 3-year national case study project that is aimed at identifying challenges, barriers, and best practices, as well as the costs and benefits associated with implementing the national standard of Canada for psychological health and safety in the workplace. And in order to help build a strong business case for adoption of the national standard by Canadian employers. The Pickering Public Library is one of our case study champions, and we're proud that they have agreed to share part of their journey with you today. Cathy Grant has been with the Pickering Public Library for 20 years and is currently the Chief Executive Officer, a position she has held since 2009. Cathy has degrees in library science and psychology, as well as a certificate in public library leadership. Tanya Sinclair is Certified Human Resources Leader with 10 years of HR management experience working for retail and public sector organizations. Tanya has worked at the Pickering Public Library since 2009 as the Director of Human Resources and also the library's Workplace Champion and the lead of their Work Well Committee at the library. Kim Affeldt, I'm so sorry if I'm screwing up the last name here, Kim, is the Senior Administrative Assistant and member of the Work Well Committee at the library. Colleen Bolin is the Manager of Client Relations and a member also of the Work Well Committee at the library. All of our speakers joining us today are here to share their experience in dealing with a workplace-related tragedy. So what will we be talking about today? We'll talk about what is grief and trauma, the grieving process, workplace impact on grieving employees, how to support staff through grief, and then we'll have a little discussion with Pickering Public Library's journey with a workplace tragedy and how they dealt with coping with the loss of a colleague, lessons learned, and applying psychological health and safety considerations. We'll be happy to take your questions at the end of the presentation. The first part of our webinar today will focus on hearing from Pam, an expert on the topic of grief and trauma. So Pam, if I could ask you a question about grief, what does grief actually mean?
Psychological.
Pam, sorry, can you repeat the beginning part of your sentence? I think you were muted at that time.
Okay. Am I on now?
Yes, you are.
Thanks. So grief refers to the process of experiencing the psychological or thoughts and feelings, the behavioral, spiritual, social, and physical reactions to the perception of loss. Bereavement is the experience of loss due to death. The grief experience will vary depending on the degree of attachment or connection or the need we had to the person who has died. And the grief may feel more exaggerated if we've experienced other recent losses in our life. So grief is normal, it's natural, and it's necessary for adjustment and health to the big changes in our life. But it's not easy to grieve in this society because we're fairly death-denying and emotion-denying. So grief actually helps us accept the reality of the death. So first we need to work through the pain of the loss and adjust to an environment where the deceased is missing. And because humans are creatures of meanings, we tend to want to make meaning out of this experience or the person's life or our own life. So that's what grief means. Okay.
Thank you for that. And with respect to the process, if we can dig a little bit deeper into that, what does the grieving process look like for individuals?
Well, the process is variable for individuals. Nobody grieves exactly the same. But the first thing that we all experience when we hear of a death is shock, denial, numbness, and disbelief. So the grieving process affects the way we think, feel, and behave. So in the beginning, we experience this psychological shock, this disbelief. We just can't see the reality of it. And at this time, we may have bursts of emotions when we think of the person or miss them at certain times of days. Now, in the cube that says emotions, we experience various emotions depending on our attachment or connection to the person. We experience the missing and the longing, sometimes very deep sadness. Some may call this depression, but it's very deep sadness. And we also have feelings of helplessness because we can't change what's happened. We can feel the anger, the guilt, the anxiety, and relief. So it's like being on a roller coaster ride with some days being a little bit better and you're calmer and other days feeling a lot more emotional. Now, the cognitive, our memories will be off, our concentrations will be off. Thinking-wise, we're always ruminating or thinking a lot about the person that's died, what happened, memories. So our minds are just flooding with memories. And that will be on and off. The different behaviors we will have the longing and searching, especially at the workplace. They'll really miss them. And the closer they worked with them, the more the miss will be. There may be withdrawal. They may copy some of the deceased behaviors, especially if they have to do some of the job that the person who died did. There'll be changes in eating, changes in sleeping habits. They may sleep more or sleep less. They may eat more or eat less. And social factors, sometimes people are wanting to talk about it and therefore will move towards other people who they think they feel safe with and will talk about the grief. Other people will withdraw a little bit more. And people tend to want to be with other people who knew the deceased so that there's a safety element there, and also they can communicate more about the person who has died. Okay.
Thank you. So looks like what we're learning is every individual has their own unique reaction to the grieving process. In that case, if we are individuals of unique natures as well as unique reactions, how can a workplace have an impact on an employee's journey of grieving?
Well, I think the thing with healing all the time is care and compassion we have for one another. So just acknowledging. Also, as you said, Nitika, knowing that the expressions of grief are individual and different and not judging one another. I think the managers and supervisors coming to the workplace as soon as they are aware of the death, and also supporting employees and letting employees support the managers and supervisors, because this will affect everybody depending on the degree of attachment and awareness they had to the working place person who died. Giving information, death notification, giving information to all employees as soon as possible of the death, even if it's on a weekend, because that can help them prepare a little bit more to coming to work on Monday. And accurate information about what happened as soon as the information is available. Almost doing a group debriefing, we would call that, giving accurate information so that rumors and horror stories don't start going around, and that people can start dealing with the truth of what happened. Allowing the people to ask questions. You know, what happened? How are you doing? How can we deal with this? And letting employees offer input into how they feel things might be handled. Information about the funeral, and also allowing people possibly to have some time off. And especially the people that were closest in working order with the person who died. The deceased person's work area is a special aspect, I think, to consider. If they had a desk, if they had a separate section in the place, or if they were working alongside other people, not to just clean out their work area and remove everything right away, to be really respectful. And rituals can tie in with that, where in the work area they could have flowers or a candle, a plant, a picture of the person who died, or a book, a memory book, either with pictures in it or a place that other employees can write messages of feelings. Going to the person's favorite coffee place. Rituals, especially in the workplace, in the work area of the person who died, can be really important. Human resource training, so that the employees know there's somebody that knows about grief and trauma, and they can go and talk to this person in a safe environment. Breaks. If they're having a rough day, you know, and people are noticing, that there's a special place where they can go and be able to have a timeout, a little bit more than a 15-minute coffee break if they need it, where they can, you know, have a cry or pull themselves together, and either somebody go with them, or sometimes people don't want other people with them. They want to be on their own. Open communication about the person who died. I think a lot of times it's very hard if we don't talk about somebody who died, because it feels like people just disappear, and none of us like that. We all want to have more meaning and context in our lives than just disappearing when we die. So open communication, and also respecting the individuality, because some people will want to talk about it and some people won't. So actually asking the employee what they want and need, and everybody might be a little bit different, and honoring that. Support and help. If a person is having a hard time doing their job, their focus is off, their concentration is off, see if one another can help and support them. And if the person is having a very difficult time, and this is where staff as well as supervisors can, you know, just not spy on, but just observe how people are handling it. And if huge changes are obvious, then talk with the employee. You know, watch for increased signs of withdrawal or anger or depression or sick time. With a lot of care and concern, talk with the employee on how they think they are doing. Suggest seeing their doctor for a checkup, or suggest a professional who might give them further support, which would go right into the referrals.
Mm-hmm. So from what we're understanding here, not only are individual reactions unique, but also what a workplace can do and react to and support employees with their reactions could also be unique. And you've given us a great list of some of the supporting tools out here. But also, with respect to the grieving itself and the level of grief, some folks might think that they're actually experiencing a trauma based on what the tragedy has been and the extent of the tragedy. Can you tell us a little bit about the differences between grief and trauma, and how might we recognize those?
Well, grief and trauma, if you have a trauma, there's always going to be some grief, regardless of the trauma. But if we're talking about how a person died, that would be more in line with the trauma. And the way people would react to this is cognitively. With grief, they focus more on the lost relationship. They focus more on the person who died. In a trauma, they focus on the traumatic event. And at the beginning, it would be more how the person died. And it would depend on whether they just heard about it or whether they were there and witnessed it. The reliving, or what they go through in their mind, is the absence of the person in grief. They are really missing them and longing and searching for them. The reliving in trauma is they're actually involved in the event, what happened, how they died, degrees of suffering, all that kind of thing. The affect, or our emotional affect in grief, is more sadness, yearning, looking for the person, separation anxiety, having to adjust to an environment where this person isn't. In trauma, the affect or the emotionality at the beginning would be fear and horror, traumatic anxiety. Grief will follow, but lots of times people have to deal with the actual trauma of what happened before they can move within the grief. In grief, the belief system can be more, how can I go on? Who am I now? In trauma, the belief system will be, why did this happen? And fear around, can this happen again? Trauma affects more our safety, our security, our self-esteem, intimacy, trust, and power and control. The memory of a person going through grief, they would approach it, they think about it, they're always thinking about this person, reminiscing and remembering. In trauma, there's phases of avoidance where they need to move away from it, especially if it's horrific, or then they will have intrusions where the psyche just is flooded with the memories of what happened. And the symptoms, the way we have physical symptoms and emotional symptoms, in grief, it will be more depressive symptoms. In trauma, it will be anxiety, agitation, and arousal.
So it looks like for a person who is experiencing trauma, they could, in fact, at the same time also be experiencing some or all of the grief symptoms and signs, and there almost looks like there might be a gray zone. So can you describe what a traumatic grief response could look like?
Well, in traumatic grief, there will be the trauma, the way the person died, and then in the center of the circle, you'll see the traumatic grief and grief. And it's a process that may take a little longer and is moved through from left to right. But the converging elements of traumatic grief response is always there'll be the shock and the numbness at the beginning. But with a traumatic death, the shock and numbness can last a little bit longer, and people can move in and out of it. So with a normal or average death, would call it a natural death from organ failure. The shock, you know, we don't want to have too many time phrases, but I would say probably from maybe 3 to 6 months. But in a traumatic death with an unnatural death, whereas somebody dies from something, organ failure, due to an external event, the shock and numbness can last a lot longer. So there's still the dysregulation. You know, we have a lot of more physical symptoms, cognitive impairment, which is memory and concentration. Our moods, the emotionality, will be on the roller coaster ride still with many ups and downs and all the emotions you can think of. I talked about how the belief systems will be affected. Behaviors will be affected also. And also how we relate to one another will be affected. Sometimes we'll want to withdraw and other times we'll need people. There's an intense psychological pain, an overwhelmed coping capacity. Sometimes it's very difficult to work, and sometimes with a very severe traumatic death, people need to have a little bit of break from work, or work becomes a very safe place where they can be with other people that are going through similar things if it's been an employee that has died, especially in the workplace where people have witnessed it. People develop a lot more risks or protective behaviors, and there's a high comorbidity rate, so people may drink more or maybe put on medication, and sometimes people get over-medicated. So there's always a risk of that and to watch for that. And traumatic grief tends to have a longer healing time. Okay.
So it looks like from a grief perspective and from the reactions perspective, again, we have the same theme going on here where every individual is unique and every individual's reaction to the incident, to the grief, is going to be unique. And I appreciate that you informed us that not only can workplace performance be either negatively impacted, or it could mean the impact, the exact opposite, where it could be workplace could be that safe zone where you want to go and you just want to immerse yourself in work. So from the performance perspective, how can grief affect performance in the workplace? What are the various aspects?
I think grief can affect performance just by people having grief bursts. They'll be more emotional coming to work, especially if the person they're missing it, the person at the workplace, their colleague. I mean, many times we spend a lot more time with our colleagues in the workplace than we do with our families at home. So we can have variable degrees of great attachment. So grief bursts are usually at the beginning of grief. People can come to work and they may feel more tired due to restless sleep, lack of sleep. Everybody grieving will have a decreased energy and tire easily. A lot of restlessness, irritability, their concentration will be off, memories will be off, and they can feel the behavioral will be feeling decreasing confidence and esteem. They may have withdrawal. They may need to talk more. And people won't feel the way they did before, their kind of normal self. They may just feel off. So there's many effects, that will affect the performance in the workplace.
And I appreciate how you gave our employers the fact that we have so many employers attending on a monthly basis for these webinars is because they actually they care about their employees, and not just that, they want to go above and beyond what just the call for duty is to do the bare minimum. They actually want to think more about how can they support employees better. And you already gave us some tools about support and help, open communication, training, and so on and so forth. So before we kind of end this session, could you tell us a little bit more about what employers can do extra to support their staff during this process of grief?
Well, I think it's really important for this employers to support their staff, because there'll be a lot less sick time and a lot more cohesiveness in the workplace. And I think the first thing is have a plan or a policy on grief in the workplace, because not only are the employees going to be affected, but so are the employers, so are the managers and the supervisors. They're all going to be affected. So if there's already a plan in place, people can just go to that without trying to have to think and remember everything to do. Care and concern. I mean, just letting your staff know by the communication, talking about the person who died, wondering how people are doing. So I think the communication and having an open communication as opposed to closed, I think is always more inviting for people. Check in with the employees. How are they doing? What do they need? Is there anything that, the employer could do to support them? Watch performance. If people, because we're always watching performance and output anyway, so if people are really struggling, offer them more support and help. If if there's some gut feelings of concern, follow them. Follow your intuition and offer them more support if they need it. I talked about rituals. I think honoring what people want to do for the person who died, also in the working space, what is done there is really important because nobody wants to just think other people disappear. None of us want to disappear. We put a lot of value and meaning to life and to relationships. Also have a private place, some place that you can tell your employees if you're having a rough day, you can go here. If you're having a rough day, the personal training, you can go to so-and-so. So-and-so understands about trauma and grief and can give you information, give you psychoeducation, can support you through this, might be able to give you a few tools on how to deal with it. And if the person is really, really struggling, have a referral source, have a list of people that you know are well-trained in trauma and grief, even outside of the workplace, so you can refer them and know that they're getting the help they need. And that's
perfect. And thank you, Pam, because I think from this slide itself, you mentioned a lot of different aspects of where employers can be a support to their staff, whether it's from a policy perspective, whether it's from training perspective, whether it's performance, and all of this can be said to have to be situated in a framework of operations where organizations can actually do tangible things. And this is not all just touchy-feely stuff. I think also the point you're making is that it's tangible, it can be done, and it's process work that organizations can take into account. And the National Standard of Canada for Psychological Health and Safety in the Workplace really does speak to that framework. And with that, I would love to, thank you for your insights, Pam, and now go to speak to Pickering Public Library, which is an organization not only implementing the national standard, but was able to use national standard as a framework and as a tool to help them with their situation that they were faced with. So let's look at a real-life world use of the learnings that we just heard about. And with that, I would love to welcome Pickering Public Library and the Work Well Committee.
Hello. Hello. Hi.
Hello. So before we start, Tanya, if I can request you to give us an overview of Pickering Public Library to our listeners.
Sure, Nitika. So Pickering Public Library, we're a mid-sized to large library. We're located in Pickering. We have 4 branches, about 100 employees, although about 64 of those employees are permanent. We are a unionized workplace, and we, in terms of health and safety and mental health, HR has oversight of health and safety and thereby oversight of mental health in the workplace. And we are a library that's doing a lot of exciting things. I think the last time we checked a couple years ago, we were the 2nd most award-winning library in Ontario. Busy workplace.
That's great. So about the overview, about the case study project activities, can you give us a bit of information on all the activities you've been involved with?
We just started working as part of the case study project with the Mental Health Commission of Canada last year, and we started our committee, I guess it would be last year as well. So we have some deliverables that we're quite proud of. So one of the biggest things was we really tied in and elevated mental health and safety in the workplace as part of our health and safety policy. That was really important. We got buy-in from our board, we got buy-in from our employees, we got buy-in from all of our senior staff members that mental health was a priority at Pickering Public Library. We formed a committee last year that meets monthly. We put in place some processes to keep mental health awareness alive each month. We also looked at some of our surveys. We did some surveys to gauge employee mental health awareness as well, too. And we did some training. So we did mental health first aid training for all of our leaders about a year ago. We offered a lunch and learn for staff members to voluntarily attend on the topic of mental health awareness. We also are going to be having this year some stakeholder training for our Work Well committee to help us to become more adept at mental health awareness. And in April of this year, we're going to be offering all of our staff members wellness sessions on the topics of mindfulness and things like that. Some of the sessions will incorporate some yoga, and that's a way that we feel helps to offer a chance to de-stress in the workplace. So we're doing a lot of things, and we feel this is all related to the case study project.
That's wonderful. How about your Work Well committee? We would love to hear a little bit more about that.
Sure. So we're sitting here in the boardroom with all of the Work Well committee members. Very honored to be here with them. There's 8 of us. We had our first meeting in May of last year. And, we really didn't know what to do when we first had our first meeting, but we knew that mental health was very important to us. And we had the standard to help guide us through, and we basically meet each month, except for some of our peak periods like December and the summer, but we meet every month and we talk about mental health and safety.
That's great. I know that you are joined here today with a few of your committee members. Perhaps I could speak to Colleen and ask Colleen about describing the situation that Pickering Public Library found themselves in. We understand that there was a sudden death of a coworker, Colleen?
That's right. Michelle was the person who passed away, and I was her manager. She worked at the library for over 10 years, and she worked at both the Central Library for about a year and a half, and she worked at one of the branches before that, so many people knew her. She was 46 years old, and she would really not be happy that I was telling everybody this, that she was 46 years old, because she appeared much younger. She was quite stylish, and she had a sweet smile and an infectious giggle. She was a single mother, and she had a daughter, a girl in her 20s. She always appeared to be in good health, and she rarely missed a day with illness, so her death was quite a shock to us. She worked with us, many of us, on Tuesday nights of the week that she died until 9 p.m., and I was one of those people she worked with. And then she left, and she got on the bus. And I remember watching her get on the bus and thinking, oh, can you imagine getting on the bus at 9 o'clock at night? And it was dark, and it was cold. On Wednesday, she phoned and said she wasn't feeling well, and she was going to take a few days off work. On Friday morning, she called, and she said she still wasn't feeling great. She was going to take the rest of the day off. On Saturday at noon, a staff person at the branch got a call from her daughter that Michelle had suddenly passed away on Friday afternoon. I can't tell you what a shock that was to all of us. The manager who was in the branch said they called me while I was out of the building on lunch to tell me the news, and I immediately went back to the library and called the CEO and the manager of HR, and then we put all our processes in place at that time.
Thank you, Colleen, for sharing that story with us and even sharing the feelings that you went through. Tanya, from the Work Well Committee's perspective and from HR's perspective, what process did the organization follow to support employees on the day of the tragedy?
Thanks, Nitika. It's funny, as I listened to Pam talk about just the whole grieving process and things that the workplace can do, I realized that we actually managed to cover most of the best practices that Pam has mentioned, and I don't think at the time we intuitively knew that we were covering all these bases, but I realized that we're getting some confirmation that we did some of the right things. Some of those things that we did, I think the first thing we did was what Colleen had mentioned. We had a quick sort of a management tete-a-tete, just a quick debrief to sort of talk about, oh my goodness, this is so horrible, what are we going to do? And I did have a procedure that I had created some time ago, hoping I would never have to use it, but I've made a procedure that covers what to do in the case of an employee death, but I made it at a time when I hadn't dealt with one. So there was this untested procedure that we had, and at the time, the three of us who were contacted, so the CEO, myself, and Colleen as the manager, my CEO said, you know what, let's pull out that procedure. So here we went, we dusted off this procedure that had never been tested, and I have to say that it helped us to have a focal point, even though at the time it was much more operational. It helped us to keep in perspective what needs to happen in an event like this. But the piece that was really important is we really immediately started to think about how we can incorporate emotional support into everything that we did in light of this traumatic event. So after we had a brief management debrief to talk about who's going to do what and talk about how we're incorporating and considering employee mental health, we thought about our mental health first aid training that we had and decided that we definitely need to take an employee first approach. And one of the things, and one of the things that we did was we increased management visibility. So that particular day, we ensured that there was management representation at each location that day and the next day, which was a weekend. So that, you know, we usually have our managers working during the weekdays, so that would be a little bit unusual, but we made sure to increase that management visibility. We also, in considering our employees' needs, we did things like offering people to go home early. We made sure we made contact with everybody that was on site. We arranged, if necessary, we were prepared to arrange for relief staff. We really decided that our culture required us to make a personal notification, death notification. So by that, we decided that it was important for us to make phone calls to notify people of this horrific tragedy. And that was based on our organizational culture, where we tend to be a smaller, very close-knit organization, and we felt that our employees would appreciate being told this information and not hearing about it through an email. We didn't want them to find out through the grapevine. So the three of us, the CEO, HR, and Colleen, we basically just decided, okay, who are you going to call? Who am I going to call? And we just sort of divvied up all of the necessary phone calls to make, and we began making phone calls and notifying people and explaining what had happened. The next thing that we did was I had contacted our employee assistance program providers to arrange for grief counseling sessions for the next business day, because again, this happened on the weekend. So the next business day would be the Monday. So on the weekend, I called Chappelle FGI and arranged to have them come on site at our branches. The next thing that had happened that day, on the day of, was our CEO, Cathy, after we sort of had done our death notifications to the staff, we wanted to actually send out an email to the broader group of staff. So she sent out an email officially, and she had attached a handout that talked a bit about self-care, so that not only are they getting notified about what had happened, but there was an attachment to talk about some things that our staff members can do to take care of themselves in this event. And she also included information about the fact that we were going to have these grief counseling sessions available for staff.
And thank you for sharing that, Tanya. And I think one point I would like to highlight here is that yes, you have 103 employees, but for those employers on this webinar who are, you know, talking about 10,000 employees or more, I think one of the strategies that you really used, which really large organizations can possibly duplicate, is that you provided your staff with all the key information that not only will help them manage their own situation at that time, but also give them empower them to help other colleagues as well, because even if you are, a relatively medium-sized organization, you were only about 8 people in the Work Well Committee, and you've got 8 people over 103 employees and 4 branches. One of the things I wanted to highlight for the listeners also is that you empowered, and speaking to also Pam's point about open communication and empowerment with communications. Thank you for that. Cathy,
and actually, Minika, one other thing I was just going to add in, if that's okay, it's Tanya.
Yes.
The other thing that, as you were talking, I realized I should have mentioned that because this was very stressful for everybody because she was a long-term employee and so well-liked, we found that as the leadership team, we had to constantly be assessing and responding according to the reactions we were seeing. So we really tried to respect individuality and realize that people react in different ways, much in the same way that Pam had mentioned earlier in this session. So we did offer people rides home. We offered to contact their family members. We contacted people to make sure they arrived safe home because people were distraught. And some people, you sort of felt to yourself, I better check in on this person to make sure they got home. So we did have sort of a call in and let us know you got there, or text us and let us know you got there. And we ourselves would reach out and call people to make sure they got home. And in some cases with people who had a really hard time, we did home visits, brief home visits, just to make sure they were coping with it as well.
Perfect. Cathy, if I could ask you a question about what happened following days, whether it was 1 week into the tragedy or a month into the tragedy and beyond, kind of how did you support staff with coping with the loss?
Sure. So the library operates 7 days a week, and while our initial response was on Saturday, and while we informed most staff on Saturday, some staff were still in on Sunday and maybe hearing for the first time on Monday. So as Tanya mentioned, we felt that our corporate culture required that we tell the bad news personally, face-to-face, wherever possible. It gave us an opportunity to really see what Pamela described as the shock and disbelief in staff. So I came in on Sunday. I greeted staff as they came through the door, and I shared the news with them if they hadn't already heard. And Sunday is also a day that frequently uses senior staff rather than managers. So a manager actually volunteered to come in to work alongside staff, continue to assess their reaction to the news, and to send them home if necessary. So they had the authority to maybe send them in a cab, give them extra breaks, that sort of thing. So on Monday, we continued again to greet staff as they came in at 9 o'clock. And at the time, we told them about our 2 scheduled grief counseling sessions, and we brought in some extra staff to allow staff to attend the grief counseling sessions. We'd had questions from staff, about what do we say to, Michelle had a lot of library clients who came in to talk to her, so what do we say to those? And so, we sent emails out about staff questions as they arose. Also on Monday, we placed a photo of Michelle with a signature frame in our communal lunchroom so staff could express their thoughts and regrets. So a lot of things that we were doing sort of fall into the ritual category. We placed a similar photo and frame at our Petticoat Creek branch. We put a memory book and a flower on her desk. We also had the case on the Monday of a security guard who we'd been trying to get in touch with over the weekend, and he doesn't technically work for the library, but he was really close to Michelle, and when we had to tell him when he showed up for work in the afternoon on Monday, he was devastated. And so, we wanted to send him home, but we wanted to send him home with pay, which is what we were able to do with all of our other staff. So he contacted his company and told him to send another guard, but to continue to give that security guard pay. And he felt he was really supported by this gesture. So that was a good thing to have done.
Absolutely.
So the funeral wasn't scheduled until the next week, but until then, we were very conscious not to remove Michelle's names from any lists. And we monitored staff's emotional reactions, which, as Pamela mentioned, were quite varied and often brought their own sort of background and history in response to grief. to this particular case. In the case of one branch, for example, we found the reactions were a little bit more emotional, so we had to put extra staffing support there. We offered to give staff leave with pay to attend the service if they were scheduled to work during this time. And we had staff who didn't know Michelle who offered to work while their coworkers attended the funeral. And we felt this was really a time to be generous with our time and resources.
Thank you, Colleen. And I know we can talk a lot about this topic, and we would love to hear a little bit about the lessons learned. And we know we have about 15 minutes left. So, Colleen, if you could share a few lessons learned with us around this episode.
Well, as Cathy has said, we thought we had spoken to everyone, but we had missed some people, and the lesson learned was to really make sure you go through the list and make sure you speak to everybody, because that one person that you missed may have had another relationship that we didn't know about. Another lesson is don't assume people's reactions or their relationships with each other. Michelle was very involved with the union, so the people who were her union colleagues and who sat on committees with her were very affected by that, which the management really didn't know about. If you don't give people time enough to grieve, they hold on to that for a long time. So you have to deal with this the right way the first time, because you don't get to come back to that again. Mm-hmm. We also learned that the care for the point people and the people who are imparting this information to other people is important as well. When I phoned Cathy, the CEO, and said, this is what happened, and I was devastated. I worked with Michelle every day. Cathy said, can I bring you a sandwich? Can I bring you a coffee? And it just touched me so much that she cared enough to make sure that I was okay. And it was just difficult, and we had to remember that the people who are caring for other people also need care for themselves.
Right. Perfect. Now, sorry, go ahead.
Oh, that's it.
Okay. Tanya, now you're the champion and the key informant for us from the case study project perspective, and you've been championing the implementation of the national standard. How would you say the national standard helped you with your journey, if at all?
Absolutely. I think before I mentioned that, I think I wanted to mention some of the statistics that were very impactful for us that we felt made us want to implement the national standard for psychological health and safety. So just the fact that 1 in 5 Canadians will experience a mental illness in their lifetime, the fact that 30% of disability claims and 70% of disability costs are attributed to mental illness, those are some facts that for us were quite eye-opening and certainly made the case for us as an organization that we needed to implement the standard at the library. And when we were faced with this tragedy, the importance of mental health in the workplace really hit home for us even more. And I think in society, we're starting to realize that psychological health and safety in the workplace is a social imperative, especially as organizations like Bell Canada and your organization provide resources to fight this stigma. And here at Pickering Public Library, as early adopters of the standard, I think for us it's really become a business imperative. In fact, I would say that implementing the standard at Pickering Public Library has now been identified as one of our strategic deliverables this year. We just feel that it's good business. It's the right thing to do for our employees, and it's the right thing for us to do as an organization. It just makes us stronger. And we've really found that by starting to go through the standard with the Workwell Committee and sharing that information from the Workwell Committee to all the other employees, we've increased organizational awareness about mental health and safety and sensitivity. Mm-hmm. In terms of the standard, there was probably 3 factors out of the 13 factors that are in the standard that really came into play with this tragedy. And I think the first one was what Cathy had mentioned, that's organizational culture. So organizational culture, if you look at the Great West Life Center for Mental Health in the Workplace, they have a website, www.workplacestrategiesformentalhealth.com. They talk about organizational culture as the degree to which work culture is characterized by trust, honesty, and fairness. And that when an organization has a healthy focus culture, employee well-being, job satisfaction, and organizational commitment is high. And that people in those types of organizations feel that they're well supported in difficult times. And I think this was really evidenced in this situation by the way that we let our organizational norms and our organizational values at Pickering Public Library guide the process of how we handle this tragedy. So using that people-first approach and being considerate of emotional hygiene and things like that, our workplace culture is embedded with so many close peer friendships that the people-first approach was really the only way to go. The other factor that I think within the standard was instrumental in helping us get through this was obviously psychological and social support. And I think that was evidenced by the way that we prioritized supporting and providing resources to staff in a variety of ways. And also I think just the fact that our staff felt very comfortable in reaching out and using those resources. So it wasn't just a matter of having resources that nobody used. We provided a variety of supports that I think everybody felt in their own little way that they were supported in some way, shape, or form. And people felt comfortable talking, or in some cases keeping to themselves with their thoughts. But I think everybody felt supported. The third factor from the standard that I think we came into play with this tragedy in losing Michelle was the clear leadership and expectations. And I think that we did try to sort of think what's the right thing for us to do as leaders to help our employees through this situation. And I think this was evidenced by the way that we did increase our management visibility. We did provide paid funeral attendance to our employees so that they could grieve and mourn without having an income loss. And we did that right from day one.
Perfect. Now, I really thank all of you for sharing the kind of the journey that you had. And it looks like, you know, you must have heard from your employees as well. So I was wondering if, Kim, you could provide us with some of the information or feedback you received from your employees regarding the support that Pickering Public Library was able to provide.
Sure, it's my pleasure. All of these points have already been mentioned here throughout our discussion, and these were comments that were made and feedback that I had heard, also being a staff member. I know that they truly did appreciate the support that was offered and provided to all of them. I know it was mentioned the personal contact. I know I personally appreciated receiving a personal phone call from Tanya that day and then finding out how this tragedy had happened. Also, the staff members really did appreciate the personal notification, as mentioned, when they came into work. If they hadn't been contacted, they heard as soon as they came to work. Again, our security guard, who is not a Pickering Public Library employee, he too appreciated the personal contact and the arrangements for him to go home, and then also his shift was going to be paid. Again, the employee assistance program, the counselor that was brought in and was in the boardroom, so anyone who felt they needed to talk about what had happened, there was someone there they could talk to on hand. There was also an arrangement that if you couldn't work or had to leave early, you would be paid for your time lost during the first couple days of the tragedy. And paid time for funeral attendance also was very important, especially to ones who wanted to really go to the funeral. And the reminder from managers, too, that we needed to be aware of how everyone reacts to grief differently, and also to be mindful and respectful of others. Example, we all have different moods, quietness, our personalities may be off when it comes to handling grief situations.
Thank you for that. So I think what we've heard here today is quite a few tools and tips for employers to employ when they are faced with such a situation. But the priority of it all is mental health in the workplace, and to keep that as a priority when you have such a situation in place, and prepare for the worst but hope for the best, as well as care for yourself. And if you remember, we're all encouraged to put our masks on before we, help our own child or the passenger next to us in an airplane. It's the same information. It's, you take care of yourself, because only then you'll be able to take care of others better. And also give your employees time to grieve and in their own ways. I really would love to thank all the panelists here today for providing us with the information and their journey, as well as the best practices that are out there. I would also like to highlight some free resources for our audience here today. As you know, you can download the standard on CSA's website, as well as the implementation guide that the Commission launched in November last year, which is also free and available on our website to download. Another resource I would like to highlight is a report that came out called Communicating in a Crisis. It's a report which provides an overview of how to create a crisis communications plan after a workplace emergency. So with that, I would like to take a few questions that have come up from our audience. One question for Pam. Pam, how do you suggest that a workplace can support employees with traumatic events as part of their jobs? For example, firefighters or paramedics.
How does the workplace support them? I think definitely by talking about it. And that's going to be a constant thing, because they're going through trauma all the time. And providing them with opportunities of learning how to self-care, how to work with their emotions. I know there's psychologists right in the paramedic and police and fire places. They have psychologists. So be able to have access to that person when they go through a traumatic loss, because that's every day in their workplace, and they really need to learn self-care. I would also like to see it implemented in their training so that they understand the importance of vicarious traumatization when we work with people, even if we don't have a connection to them, when we're seeing trauma all the time. We really have to implement self-care and do our own emotional work.
Thank you. And we have a question for Pickering Public Library as well. Were there any supports provided to the family of the deceased?
Yes, we did provide. I don't know if you remember, Cathy had mentioned that we put out a memory book, and we had our staff members who wanted to write down some comments in that memory book. And then at the funeral, we presented the memory book to Michelle's daughter so that her family could understand how much she was valued and cherished by her work family. We also, in HR, we met with the family to go over things like insurance and things like that, and help them with faxing documents that they needed to fax and things like that as well. We also, there was a donation that was also made as well as flowers.
Thank you. And from a grieving perspective, do you find that staff are still grieving for Michelle, and are you monitoring for the effect of that on performance at all? And did you find that to be the case?
I would say that we are working through the stages of grieving, but now we're sort of on the other side where we're able to just appreciate her memory. It's not as painful as it was in those first few days. I think we're able to say her name and think of her fondly, as opposed to saying her name and coming to tears.
Well, with that, I would really like to thank once again all of our panelist members for sharing their thoughts with us. I want to remind all our listeners today that our next workplace webinar will be on the topic of peer support, and we will hear from NAV Canada. The next webinar will take place on March 25th at the same time, as well as to encourage everyone on the call today to join in the conversation, to speak to what you think about mental health in the workplace, and add new content, whether it's new reports or events that you hear about, as well as share your opinion of workplace mental health with us. With that, thank you once again for everyone to attend, and please feel free to fill out our customer satisfaction survey. That will pop up with you on your screen as soon as you log off. That is a survey that helps us improve on our webinars and helps tailor our webinars to your needs on a monthly basis. So please feel free to provide that input to us. And on behalf of all of us, thank you again for joining. Have a great day.